What is Chiari?
There are three types of Chiari malformations. Chiari 1 malformation is the most common. It is present in all age groups and is being diagnosed earlier due to current imaging. It involves the cerebellar tonsils, which are located in the back of the brain, descending or hanging down below the base of the brain. It may be developmental or acquired. Chiari 2 malformation occurs in essentially all children with a myelomeningocele and is part of the neurotube defect with other associated abnormalities. Chiari 3 malformation is extremely rare and involves the cerebellum and the brainstem.
What is the history of Chiari?
Chiari malformation are a group of abnormalities of the hindbrain that were originally described by a German professor in 1891 named Arnold Chiari. His work, which was based on autopsy results, created the classic definitions of hindbrain herniation, which are now today Chiari 1, Chiari 2, and Chiari 3.
What are the symptoms of Chiari?
Symptoms of Chiari malformation may vary in intensity based on the age of the child. In greater than 50% of Chiari malformations, headache may be the only presenting symptom. Headaches often occur in the back of the head and may increase in severity with activities. In younger children who are unable to describe what headaches are like, they may have symptoms such as nighttime awakening, irritability, and head holding. Feeding problems such as choking and gagging are often present, and some children with Chiari malformation have developmental delay and clumsiness with large and fine motor skills. Some children will have significant sleep disorders, and they may also have weakness of their arms or legs. These symptoms often occur with Chiari malformation, but may or may not be related to a Chiari malformation.
Does it occur more frequently in boys or girls?
Since we really don't know what causes Chiari, or there may be several causes of Chiari, we don't really know if it affects boys or girls more frequently. So the answer is we really don't know, but there doesn't seem to be a preponderance of one sex over the other.
How is Chiari diagnosed?
So Chiari patients come to us by many different routes, and it can be diagnosed primarily from the primary care physician who had seen a child for headaches or maybe some other neurologic complaints, and has an MRI scan that shows the presence of a Chiari malformation. But it's unusual for patients to go such a direct route. Oftentimes it's a more convoluted diagnostic process. It's not unusual to see children who were initially seen in the emergency room following a mild head trauma who got a CT scan that suggested the presence of a Chiari malformation. But the gold standard for diagnosis of a Chiari is an MRI scan. And it's only been in the last 15 to 20 years that MRI scans have been so widely available that we've seen such a rapid increase in the numbers of children diagnosed with Chiari malformation. The MRI scan should be dedicated to the craniocervical junction. We also like to get an MRI of the entire spine to make sure that there aren't any cavitations of the spinal cord, often called a syrinx, or a tethered spinal cord. But once the MRI scan has been obtained, that is the gold standard test that the neurosurgeon uses to make the decision of whether or not additional treatment is indicated.
Arnold Chiari malformation type 1 is a devastating diagnosis for any parent to receive. Experiencing the Chiari journey twice has made Jim and I realize that there are far too many uncertainties and unknowns concerning this condition. That is why we have joined forces with Dr. Carrie Crone, Director of Pediatric Neurosurgery at Cincinnati Children's Hospital Medical Center, to be on the forefront of medical research, clinician and community education, and patient support. Our mission is to clarify the uncertainties, identify and define the unknowns, and begin to focus on the future of Chiari. NFCF will allow Cincinnati Children's Hospital Medical Center the opportunity to further their mission of understanding and researching the physiology of Chiari 1, as well as to better classify the variances of the condition. Secondly, NFCF will focus on creating community awareness and clinician education concerning signs, symptoms, treatment options, and care of individuals. The final mission of NFCF is to be a resource of support for patients and families as they experience the Chiari journey.
During the past 20 years, I have focused on the diagnosis and the best surgical treatment for children with Chiari 1 malformations. A Chiari 1 malformation may present with a variety of clinical symptoms that may differ depending on the age of the child. We have made significant progress in the surgical management of this difficult problem and hope to develop a better classification of this disorder that will help to define the expected outcomes following surgery. I am deeply grateful for the trust that parents have given me in treating their children, as this represents the most significant aspect of my professional commitment.